Great.
So if someone's getting their like pilot exam, that's one of the things we look for.
I want to go back to the prostate and talk to you about something that's kind of a newer emerging trend. I know that you've talked a little bit about this in previous podcasts, that a number of men, or I should say a number of physicians, are prescribing low-dose Tadalafil, also known as Cialis, to their male patients. So in dosage ranges of like 2.5 milligrams to 5 milligrams per day, but not for erectile dysfunction, but rather for improving prostate health. And presumably they get sort of a boost in terms of blood flow to the genitalia as well. But again, not specifically a deal with erectile dysfunction, but to deal with prostate health and blood flow to the prostate. Is that something that you sometimes often prescribe to your patients, and of what age?
Tadalafil is a very underrated medication. So Tadalafil is also a blood pressure medication. It can very slightly decrease blood pressure, especially at higher doses. At higher doses, a high dose would be 20 milligrams, not 2.5 milligrams. But in general, I recommend no higher than 10 milligrams a day, usually just 2 or 5 milligrams. One other benefit or other use of Tadalafil is that it increases the density of the androgen receptor, similarly to L-carnitine. So that's an interesting benefit. Another benefit is that if you give it to people with nocturia, which is urinating at night in general, it will cut the episodes in half. So it could go from 2 to 1, which can make a big difference for your sleep, which will secondarily make a big difference for your growth hormone and testosterone optimization.
And you mentioned the potential side effects on adjusting visual perception. As a vision scientist, that rings in my mind. But in terms of red-green color discrimination, I'm guessing unless you're going to be a subject in one of the experiments in my lab, or you want to be a fighter pilot, chances are you can probably get away with a little less red-green color discrimination.
Correct. It's not considered clinically significant unless someone is a commercial pilot.
Great.
So if someone's getting their like pilot exam, that's one of the things we look for.
Okay, so commercial pilots aside, you might want to ask your doctor about low-dose Tadalafil for sake of enhancing prostate health. Certainly monitoring PSA, prostate-specific antigen, is important.